I'm Ramona, and welcome to Ramona Interviews. And with me in the chair today is Mary M. Bennett. Now, she is the director of the Anger Management Program. We are so happy to have her back here again. Given the awful events that happened in Connecticut and around the world, unfortunately, we would like to dedicate this show to bringing forth some information about creating a nonviolent culture. And Mary is the perfect person to do this.
Given current events, what happened to these children, their teachers, and it's what happened to that young man that committed this awful crime. We won't know what happened there, and it's not that something like that is explainable, but it does point to a problem, that we do have a culture of violence. And maybe I should say a little bit about what I'm talking about when I'm talking about that too, you know, because I do think that in the media, I think we all know this stuff, certainly in the media, certainly video games, in our sports, and in our interactions with one another. There's almost a celebration of, and certainly it's violence sells, it's exciting. Yeah. And there have been books written about war being this experience, that the adrenaline rush that we get with any kind of a violent experience. But it affects us. It has consequences, whether we're talking about interpersonal violence or whether we're talking about something that happens on the street, whether we're talking about larger groups that are battling with one another in some way or other. It has consequences.
A little bit about trauma.
Okay.
Because sometimes when something happens and it happens, for instance, outside of yourself. So it's a circumstance like you see in the news, or you see it happening in a foreign country, or right here at home in America. And it seems so huge, so unexplainable, you know, that obviously the person who's affected by the persons affected that were there are affected by it, physically, emotionally, spiritually, mentally. They're in there. But as we watch it, as other people watch or hear about what's happening, we kind of go into a kind of trauma, don't we?
Well, I think what you're describing might be called more vicarious traumatization, that you're seeing something that is happening out in the world and our response to that. And it also brings up things that have happened to us. You know, and I think that that is what happens when we get upset with someone. You know, all of our thoughts come from someplace, and that's part of this cultural shift that I'm hoping that we can all make, you know, in understanding that's something similar to what we did with racism, sexism, or any other ism, that we start to identify it as a problem. That's something that we can, that we all need to recognize and identify, that this is an area that needs to change, that nonviolent, to be able to act with violence or any kind of aggression, that it isn't right and it isn't effective. You know, so there's that part of it too. But when we are upset, what happens is that anything that has happened to us, our thoughts come from someplace. They just don't, you know, come from the air where we have our own experiences and any kind of trauma that we have experienced. Anything, it makes us more sensitive we have enough bad experiences that have happened to us. Post-traumatic stress disorder, people that are coming back from experiences of war, people that have an accident, people that have traumatic childhood experiences, people that have been raped, any kind of these things, as they should, have affected us. They also affect our thinking and our ability to trust. What we're talking about here is that we don't feel safe in the world then. Our ability to feel safe has been undermined, and we're going to be more reactive. We're going to, like I'm doing right now, deliberately, you know, we're going to have
it's
that
like an
kind
instinct,
of, yeah,
like
we're
a
going
protective instinct.
Yeah, we're going to have this more of this response that is going to be more impulsive. We're going to be looking around. We're going to be, we'll have those kinds of things that will be happening to us because we're going to be hypervigilant, and there are other things that happen to people that have post-traumatic stress disorder that can be less severe and really significant that people can't even leave the house and function, and they're going to have many more problems with anger as a result. You know, that we really can maintain our emotional safety and our physical safety non-violently. So we're talking about redefining, instead of violence is equated with, oh, I'm going to be the tough guy, I'm going to be the person that knows how to, you come near me, this is what you're going to get, or you're going to get, you know, a piece of my mind, and, you know, and I'm going to cut you down to size verbally, that those things are actually a failure to communicate, and they're ineffective, and they cause more harm, and they're actually ultimately traumatizing. I mean, we are, I'll use this as an example, 60% of the people from Iraq, almost 60% of the people from Iraq and Afghanistan are coming back with post-traumatic stress disorder. What does that say about us as a people? It says something that is very important to pay attention to. It says that we are not meant to harm one another. It says that when there is harm, that we respond, and we cannot function well after that, where we have post-traumatic stress disorder or anxiety problems, that we're not wired, in truth, to be violent. You know, we do have a flight or fight response, and we do want to protect ourselves, and learning how to do that without violence so that we can stay connected, because everybody, that's what we're really hardwired to want to stay connected.
Connected to each other.
Right.
Just before we close, tell us about the anger management, where it is, and any other information that you'd like to give about.
Well, one of the things I want people to be aware of, we also have a couples anger management program now, and we're not calling it anger management per se. What we're saying is this is nonviolent communication group treatment for couples, so that couples can learn the skills, because I hear that all the time. I wish my wife were here. I wish my girlfriend were here. I wish my boyfriend were here, you know, that the people in their lives, they wish they could be there. And so that they're learning the skills together. So it's a very different kind of treatment. So it's not, you know, this individual couples. You can get an awful lot done when people know the skills, so that they can go home.
And they can practice it together.
Yes, exactly.
That's the idea.
You know? And so we have that for people, so that they can learn how to do this for couples, and then of course individuals, anybody that wants to learn these skills, that we have that also at UMass Medical Center in our anger management program that I'm delighted to be a part of, and it's really a privilege to be able to do this. And I want to make a plug too for the Center for Nonviolent Solutions, for the work that they're doing in Worcester in the school system, and offering mediation services in Worcester too for the people in Worcester. You know, here in Worcester there's an awful lot that is going on to promote nonviolence and to help people understand that nonviolent ways of behaving and acting are absolutely possible, and does require treatment though.
Yeah, it does.
Okay.
Thank you, Mary.
Oh, thank you, Ramona, very much. Yeah.
Please use the Center for Nonviolent Solutions. They're a great resource. They have a library, and there's many things that you can find out if you go online and check them out, or visit their facility. I think you'll find it well worthwhile. I hope that this has been informative to you. I'm sure we'll have other discussions on this as it comes about. We really need, and I agree with Mary, to work on nonviolent solutions. It needs to be what and how we see things every day throughout our society, so that we can prosper as human beings. We have a beautiful planet, and we need to be around to enjoy that, as it were. Anyway, thank you again, Mary.
Thank you, Ramona.
I'm Ramona, and you've been watching Ramona Interviews. Have a peaceful week.